with me is Chris Maher, who's a director of the George Institute for Global Health and is a physiotherapist and a leading physiotherapy researcher, and Amanda Mulcahy, who's a member of the APA, physiotherapist, and also earns a living by working for the Australian Commission on Safety and Quality in Healthcare. Welcome to you both. We're at
Morning.
We're APA conference on the Gold Coast. Now, I let physiotherapists off pretty lightly on last week's Four Corners. I didn't talk about their contribution to waste in the system. Chris, how much waste would you reckon is contributed by physiotherapy techniques that don't work?
It's very hard to get a good estimate on it, but I think all those issues that you covered across healthcare do apply to physiotherapy. So I think that's a really important point, that we have a role to contribute to improvements in efficiency in healthcare, and there's a lot of things that we could change.
Such as, Amanda?
I think we've got some good evidence, particularly in some of the orthopaedic areas around improving the appropriateness of care, and physios putting the first hands on the treatment side of things, but also the referral side. So when patients come to us, we have a responsibility to make sure that the needs and preferences of them are streamed to the right place.
So you're both being delightfully vague here. Let's get down to the specifics. The average private physiotherapist is filled with gizmos, things that sort of apply to your skin, that zap you, supposedly stimulate your muscles and do sort of things from which I'm aware there's not a shred of evidence.
There is evidence, but it shows that it doesn't work. So I think the point you're making is a good one. Physiotherapy has to change, and I think one of the areas we could change is to move away from some of the electrotherapy, the gizmo modalities. Physiotherapy is now about 100 years old. I think that's probably contemporary practice in the 1970s. I think moving forward you'll see less of that happening. What
contribution does the APA make to Choosing Wisely? And you better explain what Choosing Wisely is, Amanda.
Sure. So Choosing Wisely is a campaign that the Physiotherapy Association has recently jumped on board with. It's been started in Australia earlier this year. It's been done in the US before, and it's all about patients making the right choices for them. So lists by different specialties are developed around the top 5 things that shouldn't be done. So for example, in physiotherapy, things like using your pins and needles machines, your TENS machines and things could be something that's on that list. So we're working with Choosing Wisely, which is done by the National Prescribing Service, MedicineWise, and we're trying to develop a list at the moment with our members.
Now, one of the contentions made on the programme was that fee-for-service doesn't really work, particularly for people with complex problems, and that's an increasing area of work for physiotherapists, people with multiple diagnoses from which they're never going to get better and who are hard to deal with. And again, physios, like GPs, are paid for seeing somebody, not for making them better. Do you ever foresee a time where physios are paid for making people better?
I do, and I think there's a slight difference because GPs are paid by the federal government and in general physiotherapists are not. So I think there are some different tensions there. But I agree, I would like to see physiotherapy evolve so it was funded under MBS and we could fund a package of care of physiotherapy that would reward best practice care and reward wellness at the end of that rather than fee for service. I think a lot of the profession would be quite comfortable with that.
Amanda, do you agree?
Absolutely. We know that there is waste in the system, but it's difficult to measure because we don't actually have good evidence around patient-reported outcome measures in particular. So we don't know what the right or wrong amount of some services are. So
for the purposes of this conversation, I'm holding physiotherapy to a higher standard than we hold the rest of the healthcare system. But if we were actually going to pay for outcomes, how would you imagine physiotherapists would engage in that data collection process and feedback? Is this through a registry system? What would it look like if in fact you had a feedback loop to individual physiotherapists about the effectiveness of their care?
I think there's some already in the public hospital sector. There are physiotherapists who contribute to registries, but it's a team-based approach. So depending on the specialty area, I think private practice is a completely different situation. But when we're talking about team-based care and it's a system-level issue, particularly in the public sector, there are some examples of some registries out there that physiotherapists are a part of, but we have a long way to go.
Chris, if physiotherapists work to the full scope of their practice, what would the world start to look like?
Well, I think the world would look like a much better place. I mean, if you think...
Well, you have to say that if you're talking an APA conference.
I know, I have to. But I truly believe that there's lots of things that physiotherapists can do that they're sort of constrained with at the moment. And I think healthcare will be much more efficient. You know, looking at the gatekeepers of the workers' compensation system is the GP, and arguably they're not the best person to be controlling management of musculoskeletal conditions because in their curriculum there's a very small fraction of the medical curriculum devoted to musculoskeletal conditions, and so we put them as the gatekeeper. And I think that instills inefficiencies in the system. I think we need a greater role for the physiotherapists controlling the management of work-related injuries.
Well, we've already seen that with knee replacement waiting lists and hip replacement waiting lists in the public system, which have been a great success.
Absolutely.
Is there a future for the isolated physiotherapy private practice?
I think there is. It's isolated is a word that made me jump just then.
A lot of them are. They get referrals, but they're working as a specialist practice rather than perhaps integrated into a more comprehensive primary care network, albeit in the private sector.
You can be isolated geographically, but I think you can also be linked in terms of who you're working with. So, some of them would look to be isolated, but they will work closely with the local pharmacist, the psychologist, the sports physicians. And so I think it'd be quite unusual for a physiotherapist just to be working by themselves and their patients just being totally managed by the physiotherapist. That would be, I think, an unusual style of practice.
So what's the role for the APA in this? I mean, it's hard for representative organisations to deliver for all their members if part of the membership's rebelling against this sort of conversation.
Oh, I mean, the APA and advocacy has a lot of different arms. I think the public system is one element where the advocacy has to come politically, and it has to come through things like the MBS task force review and the primary care review. But then there's also sort of the individual onus on us as individual therapists to have a responsibility to promote appropriate care and evidence-based choices. So,
thank you very much to both. We look to this great new yonder.
Thank you.
Thank you.